Okay, so when you think about what keeps you healthy, what's the first thing that pops into your head? Probably your doctor, right? Or maybe a hospital, or the medicine you take. But what if I told you that's only a tiny, tiny piece of the puzzle? Today, we're going to pull back the curtain on what really drives our health. Check this out. According to a ton of research, the actual medical care we get, the stuff that happens in a clinic, that only accounts for about 20% of our overall health. What's really wild here is that huge slice at the top, a full 40% comes down to socioeconomic factors. When you add that to our behaviors and our environment, well, it becomes crystal clear that most of what makes us healthy or sick happens way outside the doctor's office. And this number just drives that point home. An incredible 80 to 90% of your health is decided by things happening outside a clinic. So, if it isn't doctors and nurses making up that huge chunk, what is it? That's the billion-dollar question. And that's what we're digging into right now. Well, that massive 80 to 90%, it's all explained by a concept that's totally changing how we think about healthcare. It's called the social determinants of health, or just SDOH for short. Think of it like the hidden architecture that's been shaping our health all along. So, what does that actually mean? Well, simply put, SDOH are the conditions where we live our lives. We're talking about the places where we're born, where we work, where we play. It's not just about your genes or your choices. It's about the world around you, your access to good food, the safety of your street, the quality of your school. All these things have a massive impact on your health. Now, to make sense of all this, experts have sorted these factors into 5 key areas, or domains. Let's think of them as the 5 essential building blocks for healthy life. We're going to walk through each one. First up, economic stability. And this is so much more than just having a paycheck. It's about a steady income, it's about not being crushed by debt, it's about having health insurance. I mean, think about it. If you're constantly stressed about making rent or how you'd pay for a medical emergency, that stress literally takes a physical toll on your body. Financial security really is health security. Next, we have food stability. This one's pretty straightforward, but it's crucial. It's about not going hungry, for sure, but it's also about having access to healthy food. If you live in a so-called food desert, where there's a fast food joint on every corner, but the nearest grocery store with fresh produce is miles away, that directly shapes your diet and your risk for things like diabetes and heart disease. Then there's education. This is a big one. From quality early childhood programs all the way to adult literacy, education is a gateway. It leads to better jobs, which means higher income, and it gives you the skills to understand and navigate a really complex healthcare system. The educational path you're on can basically set your health trajectory for your entire life. Our physical environment plays a huge role too. Think about it. Is your housing safe and free from things like mold or lead paint? Can you rely on transportation to get to your job or a doctor's visit? Are there safe parks nearby or streets you feel comfortable walking on? All these things in our immediate surroundings can either build us up or break us down. And last but not least, our community and social context. This is all about our human connections, our friends, our family, our sense of belonging. But it's also about negative factors like discrimination and chronic stress. Feeling supported and connected is like a superpower for your health, while feeling isolated or facing discrimination can do some serious damage. Okay, so we know these 5 domains are massively important, but knowing that is one thing. Actually doing something about it is a whole other ballgame. That brings us to the really interesting part. How do we actually teach this stuff to the doctors and nurses on the front lines? This is the key question, isn't it? How do you train a doctor to look past the symptoms and see the whole person standing in front of them? The answer is in some really cool new teaching methods that are designed to connect the dots between someone's life and their health. Here's a great example. It's a model called the 5 micro skills. It's basically a coaching playbook for teaching doctors in the middle of a busy day. It's a structured way to push a medical student to think deeper, to not just list symptoms, but to commit to a diagnosis, find the evidence for it, including social factors, and then learn a bigger lesson from the whole experience. It's all about building a new kind of clinical instinct. And a huge piece of this new training is just changing the kinds of questions doctors learn to ask. It's about moving beyond, so where does it hurt, to really understanding the why behind an illness. This question right here, it's a total game changer. It literally forces a student to make the connection explicit. So it's not just, this patient has asthma. It's, this patient has asthma, and it keeps getting worse because of the mold in their apartment. See, it completely reframes the problem you're trying to solve. Now, you can't just drop these heavy topics on students. Teaching this stuff well means you have to create a different kind of classroom. You need what's called psychological safety, a space for students feel safe to ask tough questions, admit they don't know something, and really wrestle with these complex human issues. And here's another one of those simple but powerful prompts. Asking, have we considered the patient's uninsured status? That one question can change everything. A doctor could come up with the perfect treatment plan, but if the patient has no way to pay for the prescription, that plan is basically worthless. It forces the doctor to think about the real-world barriers their patient is facing. So if there is one thing you take away from all this, let it be this. Truly effective healthcare has to be about more than just biology. It has to be about understanding a person's life. It's about treating the person, not just the patient. And that leaves us with a pretty big question to think about. There's a saying that your zip code is a better predictor of your health than your genetic code. So just imagine, what could our healthcare system really accomplish if we started treating the root causes we find in that zip code and not just the symptoms that walk through the clinic door?